Are you struggling with Nclex fluid and electrolyte questions? These are some of the most critical, high-yield questions you'll face on exam day, covering sodium, potassium, calcium, magnesium, acid-base balance, and more. In this video, we'll go through 50 carefully crafted Nclex-style questions with rationales and strategies to help you think like the examiners and never miss a tricky electrolyte question again. Stick with me till the end, because each explanation will build your confidence and sharpen your test-taking skills. Question 1. A client with severe diarrhea is admitted. Labs, Na 129 milliequivalent/L, K 3.0 milliequivalent/L, HCO3 18 milliequivalent/L. Which action is priority? A. Place the client on seizure precautions. B. Prepare to administer 4 potassium chloride. C. Restrict free water intake. D. Initiate sodium bicarbonate infusion. Answer, B. Rationale, hypokalemia, K 3.0, is life-threatening. Potassium replacement prevents arrhythmias. Strategy, when multiple imbalances exist, stabilize potassium first. Question 2. A client with SIAD has serum Na 118 milliequivalent/L. Which intervention is most appropriate? A. Increase 4 fluids to 150 milliliters per hour. B. Restrict oral fluids to 800 milliliters per day. C. Administer loop diuretic and monitor K. D. Give oral sodium tablets with water. Answer, B. Rationale, SIAD equals water retention dilutional hyponatremia. Fluid restriction is key. Strategy, for SIADH, think fluid restriction plus hypertonic saline if severe. Question 3. A client with renal failure has peaked T waves on ECG. Which treatment is priority? A. For calcium gluconate. B. For magnesium sulfate. C. For sodium bicarbonate. D. Oral K-exolate. Answer, A. Rationale, peaked T waves equals hyperkalemia. Calcium gluconate protects the heart immediately. Strategy, treat the heart first, then lower K. Question 4. A client receiving furosemide reports leg cramps. Which imbalance is most likely? A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. D. Hypernatremia. Answer, B. Rationale, loop diuretics potassium loss cramps, arrhythmias. Strategy, always link loop diuretics hypokalemia. Question 5. A dehydrated client with Na 156 milliequivalent/L requires fluid therapy. Which 4 fluid is appropriate? A. 0.45% NS. B. 0.9% NS. C. D5 NS. D. 3% NS. Answer, A. Rationale, hypernatremia equals give hypotonic fluid to replace free water. Strategy, high sodium equals give water back slowly. Question 6. A client post-thyroidectomy shows Chvostek's sign. Which lab confirms the cause? A. Na 130 milliequivalent/L. B. K 4.9 milliequivalent/L. C. Ca superscript 2 7.0 milligrams per deciliter. D. Mg superscript 2 2.0 milligrams per deciliter. Answer, C. Rationale, Chvostek's equals hypocalcemia, common after thyroid/parathyroid surgery. Strategy, after thyroid surgery, monitor calcium. Question 7. A client with heart failure is on 4 furosemide. Which electrolyte requires priority monitoring? A. Calcium. B. Potassium. C. Sodium. D. Chloride. Answer, B. Rationale, potassium loss can cause dangerous arrhythmias. Strategy, always pair HF plus furosemide potassium checks. Question 8. Which finding suggests metabolic alkalosis compensation? A. Kussmaul respirations. B. Tremors and tetany. C. Bradypnea with hypoventilation. D. Warm, flushed skin. Answer, C. Rationale, Body compensates alkalosis by hypoventilation, retaining CO2. Strategy, match acid-base with expected respiratory pattern. Question 9. A patient with hypomagnesemia is most at risk for which complication? A. Hypertension. B. Respiratory depression. C. Torsades de pointes. D. Seizures from hypercalcemia. Answer, C. Rationale, hypomagnesemia, ventricular arrhythmia, torsades de pointes. Strategy, think, low Mg superscript 2 equals irritable heart. Question 10. A client on TPN develops confusion, polyuria, Na 162 milliequivalent/L. Which is priority? A. Increase protein intake. B. Restrict fluids. C. Switch to hypotonic 4 solution. D. Administer 4-furosemide. Answer, C. Rationale, hypernatremia managed with hypotonic fluids to restore free water. Strategy, hypernatremia equals hypotonic correction. Question 11. A client with DKA has K 5.8 milliequivalent/L. What explains this? A. Excess insulin activity. B. Hydrogen ions shifting into cells, pushing K out. C. Increased renal potassium reabsorption. D. Low aldosterone activity. Answer, B. Rationale, acidosis H enters cells, K exits hyperkalemia. Strategy, link acidosis with extracellular potassium shift. Question 12. A patient with cirrhosis develops ascites. Which electrolyte should the nurse monitor most closely? A. Sodium. B. Potassium. C. Calcium. D. Chloride. Answer, A. Rationale, cirrhosis water retention plus dilutional hyponatremia. Strategy, ascites equals watch sodium. Question 13. A client has Ca superscript 2 6.5 mg per deciliter. Which symptom requires immediate attention? A. Tingling in fingers. B. Positive Trousseau sign. C. Laryngospasm with stridor. D. Abdominal cramping. Answer, C. Rationale, airway compromise from laryngospasm equals emergency. Strategy, for calcium issues protect airway first. Question 14. The nurse is caring for a patient with hyperkalemia. Which food should be restricted? A. White bread. B. Apples. C. Bananas. D. Rice. Answer, C. Rationale, bananas equals potassium rich. Restrict to lower K. Strategy, recall K-rich foods, bananas, oranges, potatoes, spinach. Question 15. A patient with burns has Na 130 milliequivalent/L. Which mechanism explains this? A. Sodium loss through tissue destruction. B. Potassium replacing sodium intracellularly. C. Increased sodium excretion from kidneys. D. Dilutional hyponatremia from fluid shifts. Answer, D. Rationale, burns fluid shifts sodium dilution. Strategy, burns equals fluid shifts hyponatremia. Question 16. Which finding best indicates hypovolemia? A. Bounding pulses. B. Jugular venous distension. C. Postural hypotension. D. Crackles in lungs. Answer, C. Rationale, hypovolemia, low BP, dizziness, tachycardia. Strategy, hypovolemia equals weak pulses plus low BP. Question 17. The nurse monitors a client with NG suction. Which imbalance is expected? A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer, B. Rationale, NG suction removes stomach acid alkalosis. Strategy, remember, vomiting or suction alkalosis. Question 18. A client with COPD has HCO3 34 milliequivalent/L. Why? A. Renal compensation for respiratory acidosis. B. Metabolic alkalosis. C. Acute metabolic acidosis. D. Sodium retention. Answer, A. Rationale, COPD causes chronic CO2 retention. Kidneys retain bicarbonate to compensate. Strategy, chronic CO2 retention. High bicarb. Question 19. A client receiving blood transfusion develops tingling and chills. Which imbalance should the nurse suspect? A. Hypernatremia. B. Hypocalcemia. C. Hyperkalemia. D. Hyponatremia. Answer, B. Rationale, citrate in stored blood binds calcium. Hypocalcemia. Strategy, blood transfusion reaction equals watch calcium. Question 20. A client with K2.4 milliequivalent/L is started on 4 kCl. Which nursing action is priority? A. Administer kCl as 4 push. B. Dilute and infuse via 4 pump. C. Hang kCl as piggyback with antibiotics. D. Give IM kCl injection. Answer, B. Rationale, potassium is never 4 push or IM. Must be diluted and given with a pump. Strategy, potassium equals no push, no IM, always dilute. Question 21. A client with vomiting for 3 days is admitted. ABG shows, pH 7.50, PaCO2 48, HCO3 32. Which disorder is present? A. Metabolic acidosis with compensation. B. Metabolic alkalosis with partial compensation. C. Respiratory alkalosis with no compensation. D. Mixed acidosis. Answer, B. Rationale, pH high, alkalosis, HCO3 high equals metabolic alkalosis, PaCO2 slightly elevated equals compensation. Strategy, match pH with main abnormal value, then check compensation. Question 22. A patient with dehydration has urine-specific gravity 1.035. Which interpretation is correct? A. Normal hydration. B. Fluid overload. C. Concentrated urine, dehydration. D. Renal failure. Answer, C. Rationale, high specific gravity equals concentrated urine, dehydration. Strategy, remember, low Sg equals diluted urine, high Sg equals dehydration. Question 23. A patient with Addison's disease is admitted. Which electrolyte imbalance is expected? A. Hypernatremia and hypokalemia. B. Hyponatremia and hyperkalemia. C. Hypercalcemia and hypernatremia. D. Hypomagnesemia and hyperkalemia. Answer, B. Rationale, Addison's equals low aldosterone Na loss, K retention. Strategy, Addison's equals low sodium, high potassium. Question 24. The nurse notes serum Na 115 milliequivalent/L in a patient. Which assessment finding is priority? A. Abdominal cramps. B. Headache and confusion. C. Muscle twitching. D. Nausea and vomiting. Answer, B. Rationale, severe hyponatremia, cerebral edema, neurochanges. Strategy, sodium affects the brain first. Question 25. A client with Cushing's syndrome will most likely have which imbalance? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hypocalcemia. Answer, C. Rationale, Cushing's high cortisol Na retention, K excretion. Strategy, Cushing's equals high sodium, low potassium. Question 26. The nurse is teaching about foods high in magnesium. Which should the client include? A. Cheese. B. Bananas. C. Spinach. D. Rice. Answer, C. Rationale, spinach is rich in magnesium. Strategy, Mg superscript 2 sources equals green leafy veggies, nuts, whole grains. Question 27. A client with Ca superscript 2 12.5 mg per deciliter is admitted. Which nursing action is most appropriate? A. Encourage fluids. B. Place on seizure precautions. C. Restrict sodium intake. D. Prepare to give 4 calcium. Answer, A. Rationale, hypercalcemia causes kidney stones, fluids help prevent precipitation. Strategy, hypercalcemia equals hydrate to flush calcium. Question 28. A patient has K 2.8 milliequivalent/L. Which ECG change is expected? A. Tall, peaked T waves. B. U waves. C. Widened QRS. D. Prolonged PR interval. Answer, B. Rationale, hypokalemia equals U waves on ECG. Strategy, ECG clue, hyperkalemia equals tall T waves, hypokalemia equals U waves. Question 29. A client with Na 170 milliequivalent/L is lethargic. Which force solution should be anticipated? A. 0.9% NS. B. 3% NS. C. 0.45% NS. D. D5LR. Answer, C. Rationale, hypernatremia requires hypotonic fluids, 0.45% NS. Strategy, high sodium equals hypotonic replacement. Question 30. A patient with parathyroidectomy develops tingling lips and hands. Which imbalance is likely? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hypernatremia. Answer, C. Rationale, removal of parathyroid hypocalcemia. Strategy, post-parathyroid equals watch calcium closely. Question 31. A client on digoxin has K 2.9 milliequivalent/L. Which risk is greatest? A. Bradycardia and toxicity. B. Hyperreflexia. C. Seizures. D. Respiratory depression. Answer, A. Rationale, hypokalemia increases digoxin toxicity risk. Strategy, potassium plus digoxin equals toxic combo when low K. Question 32. A patient with diarrhea is most at risk for which imbalance? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Respiratory acidosis. Answer, B. Rationale, diarrhea equals loss of bicarbonate metabolic acidosis. Strategy, vomit equals alkalosis, diarrhea equals acidosis. Question 33. Which assessment best confirms fluid volume overload? A. Dry mucous membranes. B. Crackles in lungs. C. Orthostatic hypotension. D. Increased urine-specific gravity. Answer, B. Rationale, crackles equals fluid in lungs. Strategy, FE equals lung sounds plus edema plus JVD. Question 34. A client with SIAD develops serum Na 110 milliequivalent/L. Which intervention is priority? A. Administer hypertonic saline slowly. B. Increase free water intake. C. Give hypotonic for fluids. D. Administer loop diuretic only. Answer, A. Rationale, severe hyponatremia, less than 120, equals risk of seizures hypertonic saline. Strategy, Na less than 120 equals 3% saline carefully. Question 35. A patient with hypocalcemia is started on calcium gluconate. Which drug should the nurse verify before giving? A. Furosemide. B. Digoxin. C. Prednisone. D. Heparin. Answer, B. Rationale, digoxin plus 4 calcium equals fatal dysrhythmias. Strategy, calcium plus digoxin equals check orders carefully. Question 36. A client with renal failure is at risk for which imbalance? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia only. D. Hypocalcemia only. Answer, B. Rationale, kidneys excrete K. Renal failure equals hyperkalemia. Strategy, renal failure equals watch potassium rise. Question 37. A patient on thiazide diuretics is most at risk for which imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. D. Hypernatremia. Answer, B. Rationale, thiazides waste potassium. Strategy, most diuretics equals K wasting, except spironolactone. Question 38. A client with Ca superscript 2 6.8 mg per deciliter is at risk for which complication? A. Tetany and seizures. B. Kidney stones. C. Lethargy. D. Pathological fractures. Answer, A. Rationale, low calcium neuromuscular excitability tetany/seizures. Strategy, hypocalcemia equals twitchy, hypercalcemia equals sluggish. Question 39. A patient with Na 125 milliequivalent/L reports nausea and headache. Which intervention is best? A. Restrict free water. B. Give hypotonic 4 fluid. C. Encourage oral fluids. D. Administer diuretic. Answer, A. Rationale, hyponatremia equals restrict water to prevent further dilution. Strategy, SIAD/hyponatremia equals fluid restriction. Question 40. A client with hyperkalemia is given 4 insulin and glucose. What is the purpose? A. Increase renal excretion of potassium. B. Shift potassium into cells. C. Eliminate potassium via stool. D. Dilute potassium in circulation. Answer, B. Rationale, insulin drives K into cells with glucose. Strategy, hyperkalemia insulin plus glucose intracellular shift. Question 41. Which client is most at risk for hyperphosphatemia? A. Client with hypoparathyroidism. B. Client with vomiting. C. Client with dehydration. D. Client with loop diuretics. Answer, A. Rationale, hypoparathyroidism decreased phosphate excretion. Strategy, parathyroid hormone equals inverse relation Ca superscript 2 and phosphate. Question 42. A patient with Mg superscript 2 5.5 mg per deciliter is drowsy and has absent reflexes. Which treatment is expected? A. For calcium gluconate. B. For magnesium sulfate. C. Oral potassium. D. Loop diuretic. Answer, A. Rationale, hypermagnesemia depressed CNS calcium gluconate reverses effects. Strategy, high Mg superscript 2 equals antidote is calcium. Question 43. A client receiving large doses of steroids is most at risk for A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. D. Hyperphosphatemia. Answer, B. Rationale, steroids mimic aldosterone K wasting, Na retention. Strategy, steroids equals retain Na, waste K. Question 44. A patient has positive Trousseau's sign. Which imbalance is suspected? A. Hypocalcemia. B. Hypercalcemia. C. Hyperkalemia. D. Hyponatremia. Answer, A. Rationale, Trousseau's equals hypocalcemia. Strategy, Trousseau plus Chvostek equals classic hypocalcemia clues. Question 45. A client with hyperkalemia is prescribed sodium polystyrene sulfonate, Kexolate. Which finding shows effectiveness? A. Decrease in urine output. B. Soft, formed stools. C. Potassium within normal range. D. Increased appetite. Answer, C. Rationale, Kexolate removes K via stool goal is normal potassium. Strategy, effectiveness equals labs normalize. Question 46. A patient with Na 112 milliequivalent/L begins to seize. Which drug should the nurse prepare? A. 3% NS. B. 0.45% NS. C. Furosemide. D. Spironolactone. Answer, A. Rationale, severe symptomatic hyponatremia requires hypertonic saline. Strategy, seizure plus low Na equals hypertonic saline. Question 47. A client receiving diuretics develops flattened T waves and muscle weakness. Which lab result is expected? A. Na 155 milliequivalent/L. B. K 2.9 milliequivalent/L. C. Ca superscript 2 11.2 milligrams per deciliter. D. Mg superscript 2 4.0 milligrams per deciliter. Answer, B. Rationale, flattened T waves equals hypokalemia. Strategy, ECG, low K flat T waves, U waves. Question 48. Which client is at greatest risk for hypophosphatemia? A. Chronic alcoholic. B. Renal failure. C. Hypoparathyroidism. D. Addison's disease. Answer, A. Rationale, alcoholism, poor intake and absorption, hypophosphatemia. Strategy, alcoholics equals low phosphate plus low magnesium. Question 49. A patient with diabetes insipidus is admitted. Which imbalance is expected? A. Hyponatremia. B. Hypernatremia. C. Hypocalcemia. D. Hyperkalemia. Answer, B. Rationale, DI equals massive water loss, concentrated sodium. Strategy, DI equals hypernatremia plus dehydration. Question 50. A patient with pancreatitis develops Ca superscript 2 6.7 milligrams per deciliter. Which sign may appear? A. Chvostek's sign. B. Polyuria. C. Muscle weakness. D. Bradycardia. Answer, A. Rationale, hypocalcemia in pancreatitis, positive Chvostek's sign. Strategy, pancreatitis equals watch calcium levels. Great work making it through all 50 fluid and electrolyte questions. Remember, mastering these questions isn't just about passing NCLEX, it's about becoming a safe, confident nurse at the bedside. If this video helped you, don't forget to like, share, and subscribe for more NCLEX practice and nursing tips. Drop a comment with the topic you'd like me to cover next. I'm here to make your NCLEX prep easier. Until next time, keep practicing, stay motivated, and believe in yourself. You've got this.